Hello, everybody. This is Dr. Aryan Mowlavi coming to you from Ask Dr. Mowlavi series. I want to invite everybody to send their questions to Ask Dr. Mowlavi at cpsi360.com. Today's question comes from Lily, who lives in Minnesota, and she wants to know, is there any way that I can tighten my skin without having a cut? This is an excellent question, Lily, and I want to get into today's topic, which is going to be called Scarless Skin Tightening, a game changer. What are we talking about, everybody? You see, when it comes to the body contouring arena, we today as surgeons have to balance, and it's a tightrope act of balancing extra fat and extra skin. You can't just get rid of all the extra fat without being cognizant of the extra skin. In fact, if you remove too much fat and leave extra skin, you're actually going to get a botched body contouring or liposuction result, because what happens is the irregular or redundant skin doesn't know how to settle naturally and evenly, and it ends up crumpling up and gathering in unnatural and basically operated in deformed fashion. So traditionally, when we've been removing extra fat, what we've had to tell our patients when they had redundant skin is they had to have their skin cut out. That's called excisional surgery. And it is the definitive gold standard way to remove extra skin. I mean, it's intuitive. If you have extra skin, you got to cut it out. However, when you cut something out, i.e. excisional surgery, you're going to be left with a surgical incision line. Yes, that's what we call it, a surgical incision line, which can subsequently scar. It can lead to prolonged recovery times. It can make your recovery period a little more difficult and prolonged. So what we're talking about is until today, or recently, we've had no other alternatives. If you had redundant skin and we were doing body contouring on you, we'd have to consider excisional surgery. Today, I want to share with you a new technology called Renuvion, R-E-N-U-V-I-O-N, subdermal coagulation. And this machine is put out by Solta Medical, and it involves a wand that emits helium-activated plasma energy that has been fused with radio frequency energy. And the combination of these two energies allows us to tighten your skin without having to cut it. It's a real game changer, and I want to share with you all what is done for our practice and for practices across the country. What we're talking about is expanding our patient population. And what I'm talking about is the older patient population and the younger patient population, and additionally, the gentlemen. So what are we talking about? The older patient population is scared of surgery. They're scared of more extensive, more aggressive surgery. Often they don't want to be put under. They don't want to have general anesthesia. And they don't want to have to recover from prolonged or more extensive surgeries. They want to have an easier recovery period. The second population I want to talk to you about is the younger patient population. These patients, unlike the older patient populations, are often in the workforce, so they can't have prolonged recovery periods. And so they want to avoid excisional surgery. In addition, this patient population often doesn't want anybody to know they've had surgery. They really feel intimidated because they don't want people to think, well, you're too young for surgery. So they don't want anybody to know. They don't want the stigma of a surgical incision line. And then finally, we have the gentlemen. The gentlemen in general are more embarrassed of having cosmetic surgery. Traditionally, our patient population breakdown has been 90% females, only 5 to 10% males. So this is understandable. In addition, often the gentlemen are in the workforce and they don't really have time to take off from work, just like the younger population. And so excisional surgery has forbid them from undergoing cosmetic surgery. For all of these patient populations, now we have an alternative that is viable, effective, and provides a skin contraction ability. I just wanted to talk to you simply about a couple special surgeries that these patient populations are undergoing. and kind of give you an idea of what we're talking about. So for the older population, what we're talking about is the gals in their 60s and 70s. And, they wanted that face and neck lift because they wanted to improve the turkey gobble look or tighten their cheeks and jowls. But they just didn't want to have that excisional surgery. They didn't want to go under for 2 hours, 2.5 hours, 3 hours. And they just were scared of surgery. They didn't want to have a prolonged recovery period. Well, for these patients, now we can do Renuvion subdermal coagulation and ablative skin resurfacing, which is off-shelf FDA use. But basically what we're talking about is being able to do these patients without having to go under, number one. Number two, we can do it expeditedly in about half an hour. And the third thing is their recovery is a lot easier on them. They don't have to worry about incision lines healing. They don't have to worry about drains. And it has made it possible for them to enjoy looking rejuvenated in the face without having the old-fashioned traditional face and neck lift surgery. Let's talk about the younger patients. The younger patients, similarly, in their 30s or 40s, genetically, some of them age quicker, and they can even notice redundancy in their neck and skin, even at the early age of 30, late 30s and early 40s. And previously, they just couldn't fathom undergoing a face and neck lift. And so for them, in addition, we're able to provide them this opportunity to undergo tightening of the neck area without having to have incision lines. So no stigma of surgeries. They're able to recover quick, and they can enjoy looking rejuvenated. Let's talk about a couple other areas. The arms, the grandma arms. The grandmas really often hate their arms. They call them bat wings, and they want these eliminated. They're tired of the grandkids pulling on them. Well, guess what? Now with the introduction of Renuvion subdermal coagulation, we can tighten these arms. We can not only lipo the arms and remove the extra fat, but then we can tighten that skin so it's taut and not pullable, and eliminate the bat wings without having a long cut that requires prolonged recovery periods. Let's talk about the gentlemen. The gentlemen really don't want incision lines. They're very embarrassed of having surgery in general. And so when it comes to contouring the abdomen and the chest and their love handles, well, they might accept an incision line low in their abdomen areas. But God forbid if we're going to extend those incisions laterally around their torsos and into the love handles, where most of them have a prominence and carry a lot of their weight and extra skin. In addition, the gentlemen that want chest contouring often have a lot of extra fat and skin in their armpit areas, but we had no alternative to get rid of the extra skin. Well, guess what? Today, with subdermal coagulation and the use of Renuvion, we are able to provide gentlemen an alternative to treating the love handle and flank areas as well as the armpit areas or lateral chest areas. Once again, we are able to lipo the love handles down so that they're not prominent, but more importantly, we're able to eliminate the skin redundancy in this area, not only in the love handle area, but also in the lateral chest and armpit area. And the lateral and chest and armpit area really allows us to optimally contour their chest and breast area so that they look more refined. Anyways, I hope all this was helpful for you. I think Scarless skin tightening without the use of excisional lines and surgical incision lines is really a game changer. Renuvion technology has allowed us now to provide alternatives to a whole new patient population that really were not good candidates for cosmetic surgery. If you're interested in asking any questions regarding any of these surgeries, I ask you to send us your questions at Ask Dr. Mowlavi, that's DRMOWLAVI, at cpsi360.com, and I will get to them in the near future. And also, please visit us at cpsi360.com. At our homepage, there's a blog tab that you can push to see all of my other series videos. Thank you, and I hope you have a nice day.